Good afternoon. Thank you, Chairman, Governor, Mayor. I also want to acknowledge Kathleen and all the staff and community members here at the Warwick Senior Center. Community organizations like senior centers have been such critical parts of our response to the COVID-19 pandemic here in Rhode Island. So it's an honor to be here. Our community partners have been receiving and giving out vital resources and information to people in the community. They've been hosting testing events and vaccination events for their regular visitors and for the larger community. And now it is great news that many community organizations are helping to make booster doses of the Pfizer COVID-19 vaccine available, as we're seeing here today. Many of the people who are now eligible to receive a booster shot got their initial shots early in the vaccination campaign and will benefit greatly from additional protection. By and large, all of us who have been fully vaccinated are very well protected. But it's helpful to know that for these specific populations who are at higher risk, booster doses are now available for you. These are people 65 years of age and older and residents in long-term care settings, regardless of their age. They can receive a booster shot at least 6 months after their primary series. Also, people 50 to 64 years of age with underlying medical conditions should also receive a booster shot as well. For those who are 18 to 49 with underlying medical conditions, it's an option. You may be able to receive a booster shot, and those who are 18 to 64 who are at increased risk for COVID because of what they do or where they work or live also may be able to receive a booster shot. So people in these last two groups, because it's an option, it's not to the level where we're saying you should, as we are with the first two groups, you have the ability to talk to your healthcare provider to see if they do recommend you to be vaccinated. The fact that it's available for these groups that are at higher risk is great news. It's also important to know all of those who have received our 2 doses are also protected. That's the critical piece, and especially knowing that that opportunity is going to be in place for our younger children in the coming weeks. That's also important. With the more contagious Delta variant's dominance in Rhode Island, getting fully vaccinated, and if you're eligible to get the booster shot, it will help strengthen protection against severe disease in those who are at higher risk. And of course, if anyone 12 and older has not yet received their first dose of COVID-19 vaccine, they absolutely should get vaccinated today. Please let your loved ones know, let your co-workers know, your neighbors, anyone, everyone who is eligible should get in a setting where you know you will be protected against COVID vaccine is of the utmost importance. We also want to make sure the vaccine is available for people who are pregnant or who are planning to become pregnant. Just yesterday, the Centers for Disease Control and Prevention urged vaccination for people in this particular situation. Pregnant women with symptomatic COVID-19 are twice as likely to be admitted to the ICU. They are at increased risk for adverse pregnancy outcomes if they obtained COVID-19. If you are pregnant, the reality is that COVID-19 presents a risk to you and to your baby. Getting vaccinated to protect yourself and to protect your baby is the best approach. Speaking of our babies, our children, the governor spoke a little bit about schools. We agree 110% with the importance of doing everything we can to keep our children in schools. While some schools may be exploring the pilot program that the governor referenced, I want to make sure that all schools, all parents know about the steps that are in place that every school can take right now to reduce the amount of quarantining that happens and to help ensure that your kids are able to stay in school. It doesn't require anything additional. It's what is at our fingertips and available to schools, students, and parents now. Number one, ensure consistent mask wearing. We have implemented the CDC's close contact exemption that allows students to not quarantine and stay in school if they were wearing a mask and achieving a few of the other conditions met. This is possible to start doing now. So parents, as you send your children to school, help ensure, are they wearing masks? Are the things in place to ensure that masks are being worn consistently? The second step that can be taken is ensuring that 3 feet of distance is maintained for students while they are in school. Since day one, we've been talking about how effective social distancing is to reduce transmission. That space helps decrease the risk of transmission, particularly within an unvaccinated population. 3 feet of distance is another condition that's needed for that CDC's close contact exemption, along with masks. And the third step is effective contact tracing. This helps us focus on the students who truly are close contacts and really helps us limit the number of students who are quarantined that aren't close contacts. Parents, families, school communities, the way to help schools do this is to ensure that they are keeping accurate seating charts, both for classrooms and school buses. In our discussion with the Centers for Disease Control leadership on this just yesterday, they confirmed with us the most effective way that every student can ensure that we are only quarantining those who need to be quarantined and keeping as many children in school as possible is to ensure that masks are being worn, is to ensure that 3 feet of distance is maintained, and ensure that all of the steps to allow for contact tracing are being done. Are your seating charts being maintained? Are we able to tell where students are and be able to make the difference in determining whether or not someone can actually just stay in the classroom? So please know that this is what works. These are the areas where we can focus. We're very close to having a vaccine for our younger students. Some health officials are speculating that we could have vaccine for children 5 to 11 years of age in a matter of weeks. The vaccine available for these students will be another tool to limit spread, limit quarantining, and keep children in school. We want to ensure that everyone understands these are the critical ways we can make that happen. One last topic I want to address briefly today is testing. Demand for COVID-19 testing is very high right now, and that is an excellent thing. We want everyone to continue to access the resources that we have. Most PCR test results are coming back within 48 hours. There are a small percentage that are coming back slightly later than that. Our testing turnaround times are right on par with numbers of testing turnaround times in states throughout the country, if not ahead. But we are aware of the feedback and are responding by doing things like working to expand and improve our lab and operational capacity so that everyone, more than the 90+% already that are experiencing the 48-hour turnaround, but everyone gets to do that. Many of you contact the Rhode Island Department of Health directly to schedule your tests or get results. And we want to continue to encourage that. That number has increased quickly and significantly, which is great. Our COVID-19 call center and inbox are experiencing a high volume of calls and emails right now as we adjust to that increase. Keep that coming and continue to know that you can access self-scheduling for your test online at portal.ri.gov. And if you're contacting us about your test results, in addition to being able to check for those results online, be patient and know that our teams are working hard to make sure that we can respond and continue the advanced work with testing and vaccination that we have been accomplishing here in Rhode Island.